So let's get straight to that. Our top story. South Africa has one of the highest rates of violence against women and girls globally, with at least 35,000 girls aged between 10 and 19 getting pregnant and 1,300 new HIV infections detected in young girls weekly. The Department of Basic Education has told Parliament's Portfolio Committee on Basic Education that girls and young women between the ages of 10 and 19 made up 12.67% of the total population, according to South Africa's latest National Strategic Plan on HIV, sexually transmitted infections and tuberculosis. Girls and women between the ages of 15 and 24 had the highest rate of new infections. In 2016, this group accounted for almost 40% of new infections. To talk more about this, Dr. Thato Chidarikire, a very good evening to you, and thank you so much for speaking to us. She's the Director of HIV/AIDS Prevention Strategies. As I mentioned, these figures, at least within this age group, are not new, but do we really understand what is happening and why the figures are what they are?
Good evening, Sepiso, and good evening to the listeners. I would really say that the figures as they stand are quite alarming, and we, as a department, we really are striving to reduce incidence of HIV in young people and in the population in general, as well as unplanned pregnancies. So if we're looking at a little bit of data history, we would remember that in 2017, there were about just over 2,000 infections in adolescent girls and young women per week. In 2018, that number was reduced to about 1,400. In 2021, it is now at 1,300. So in general, we are seeing a bit of a downward trend, but again, it is not really going down as fast as we would want it to be and as steep as we would want it to be. So we really need to work together, Department of Health, Department of Basic Education, DSD, and parents in general, to ensure that we support our young people, to ensure that we are able to prevent unintended pregnancies as well as HIV and other STIs.
So you've been in the sector, I know, for quite a while, working with not only young girls, but especially as we spoke about HIV and sexual reproductive health rights. So what are the causes of the numbers that we're seeing, the high pregnancy rate, the high prevalence of HIV infections in this group of young teenage girls and girl children, really?
The contributory factors are multifaceted, so we can maybe talk to, let's say, biomedical factors, we'll talk to social, economic factors, and even educational factors. If I were to start with educational factors, that really cuts across. If we are able to keep young children or young girls in school at least until matric, we should be able to at least curb the numbers of pregnancies that we see. We have seen, and data has shown, that young people that stay in school we are able to actually keep them away, or at least prevent some of these unintended or undesirable outcomes. We look at biomedical factors, and we look at issues of evolution, the diet, early puberty, developmental and hormonal stimulations, early menses, early sexual debut. So it's a mix, as I say, biomedical, social, behavioral. We have seen since 2017 that even sexual debut has increased in young people, and this is why we are getting some of these undesirable issues, especially unintended pregnancies as well as HIV, because we've also seen a reduction or maybe not so much of a commitment in terms of prevention, contraceptive use, condom use, so that we can prevent. So, as I say, it goes back to us all working together in a multisectoral manner to ensure that we get to the impact that we're looking for.
So how will you do that? Because I understand that the Department of Health, Social Development, Department of Basic Education have an integrated school health policy, and some of these incidents actually occur at schools. We know that during a lockdown, there were numbers that were reported of higher or a spike in teenage pregnancies, and that also included sexual violence, even at home, where children were locked out. So how would this integrated approach work?
So again, as we say, as you rightfully said, the incidents are not necessarily only happening at home, but they're also happening in schools. So this is why our awareness, our education, and what is being done when one is found, let me say, guilty, for lack of a better word, of these undesirable issues or things that happen to young people. So education is very important. Awareness is very important. We have introduced for many years, for a few years now, comprehensive sexuality education, sexual reproductive health and rights. So really, we need to ensure that everyone adheres to the policies of the country in general. Our constitution is very vocal on human rights, and we know that as a country, we are very protective of rights, especially rights of young people. So we just really need to, the policies are there, they're very progressive. It's actually translating policies into use and ensuring that people comply and adhere to the policies.
So I want to talk about myths versus facts, especially socially, culturally. I mean, you'd often hear some people say it's because young girls are becoming sexually active too early, and the kind of diet that they are eating makes them fertile. There's also the conception that young girls deliberately go out of their way to get pregnant so that they can claim child grants. Talk to us about some of the thinking and how it works. Is it counterintuitive to what you're trying to achieve?
Right. So some of what you have mentioned are also what I mentioned earlier in terms of the contributory factors. So in support with the Department of Basic Education, we would really like to ensure that we keep young people in school. It has been shown worldwide, Sub-Sahara, East and Southern African countries, South Africa included, that if young people are kept in school until matric at least, we are able to curb some of these issues. And then we still need to look at data, that confirms the anecdotal information that we get. But yes, we do get anecdotal information, even issues of SASA, but we need to ensure that we get the data that actually supports that. Because while we're able to support young people that have had children, or let me say that have had their pregnancies early, and that's what the grants are for. So we need to maybe somehow find a way of enforcing that they are actually used for that, not used as a scapegoat to try and get some money.
And I'd imagine that the criminal justice system itself has to enforce the law. If you're talking about 1,053 pregnancies being recorded between children of the ages of 10 and 14, and while I acknowledge the age of consent at 12, but isn't that somewhat a bit ridiculous that we're still talking about that?
Really, we wouldn't, and ideally, and I do believe even our policies really do not recommend or even encourage sexual debut at that very early age. And we have tried to put in place interventions. For example, courses and programs of families. We have a program called Families Matter, where we try to engage not just the young people, but also the families and the communities, so that everyone is able to understand what we are putting in place. Because as much as sometimes you may say that maybe data may not be getting to, let's say, to communities, but we see our young people, our young sisters, our young girls getting pregnant at a very early age. So we really, really need to work together from the home, through the community, into the school. So the parents, the teachers, the community, we all need to work together. And really, we can't be talking about a 12-year-old having a child and be talking about consent, because, the 12-year-old shouldn't even be consenting for sex. It's not even legal. Right. So, yeah, it's not okay.
Part of a broader discussion that we should be having. Thank you so much for speaking to us, Dr. Thato Chidarikire, Director of HIV/AIDS Prevention Strategies. And